Hello and welcome. I'm Dr. Melissa Grill-Peterson, Functional Wellness Specialist, and your guide to taking you through tonight's webinar, Why You Still Have Thyroid Symptoms Even if you're on medication. Now, look, if you have struggled, if you've got questions, if you feel like something's just not quite right, and you feel like somebody's not listening, then you want to make sure you stay on tonight's webinar. Myself and the team of integrative health and wellness specialists at Optimum Health are here to help you. And tonight I'm going to shine some light on some of the darkness, the depression, the frustrations that you may be struggling with. So let's get right into the presentation so that we can get busy helping you get well. So who is this webinar actually for? I want to make sure to be really respectful of your time, make sure you're in the right place. So this is for you if you've been diagnosed with a thyroid condition. It's for you if you suspect that you have a thyroid condition. And it is for you if you are sick and tired of feeling sick and tired and wondering, where is the real answer? You have a sense that there's more, and that's why you're tuning in tonight. Well, I can tell you there are more answers, and we're going to get to the root cause tonight. We're going to dig deep, so hang on tight. How do you know if this is you? Maybe you think you might have a thyroid issue, you think there could be something going on, but you're not exactly sure. Well, let me help you to understand the most common signs and symptoms of thyroid issues. You're feeling tired and sluggish. It's hard to get out of bed. It's hard to move through the day. Your brain is foggy and fuzzy. You feel like you're forgetting more than you're remembering. Your hair is thinning, and your eyebrows, the outer thirds of the eyebrows, are beginning to thin as well. You've got cold hands and cold feet. You're having bowel difficulties, GI problems like constipation. You could even be having some constant bloating and abdominal pain. Difficulty losing weight. Now, this is something that most people associate with thyroid, but again, there's a lot happening. So it can be much more than that. Maybe you're suffering from morning headaches, hot flashes, or night sweats, mood swings, depression, anxiety, difficulty sleeping that's getting even as severe as insomnia. Now, if you've said yes to 2 or more of these, then you've got some things going on. Your body's talking, and you're in the right place so that you can start listening. So tonight, if you resonate with any of this so far, stay on this webinar, because here's what we're going to cover. You're going to be able to find out what's really going on with your thyroid. You're going to understand why medication alone is not working to get rid of your symptoms, what is actually making your symptoms worse, and what you can immediately begin to do about it. Yes, I'm going to give you some key takeaways tonight so that you can leave this webinar empowered to begin to know what your next steps are. I'm going to help you find your answers so that we can actually put a roadmap in place for you to begin to restore your health. Sound good? All right, well, we've got to dive in and ask the question, what the heck is really going on? Because if you're somebody that's already been diagnosed and you're on medication, you go into your doc, they're running the tests, and your thyroid levels, they tell you, are normal. So they tell you, hey, you should be feeling fine. But your response is, no, I'm not feeling fine. You're not listening to me. This isn't working. So they raise your dose. You come back. You still say, well, it worked for a couple of weeks, but then it stopped working again. Something else is wrong. What is it? And they're not sure. Because in the traditional medical paradigm, we are taught to treat symptoms. Symptoms, it's cause and effect. So traditional medicine, which is one of the best medical systems in the world that we have for acute traumatic injury, but we are facing a crisis in America right now, which is a crisis of chronic healthcare disease, and chronic disease processes going on. So we're really in a place where our traditional system doesn't quite have the answers, because what we do is acute care and we manage symptoms. But you see, what we do at Optimum Health is we look below the surface. We want to ask that question, why? Why are there symptoms? Why are you having hot flashes? Why can't you get rid of the weight? Why are you tired all the time? That's the real question. And unfortunately, there's not time nor the resources in traditional medicine to be asking that, because look, healthcare is a business like everything else, and I'm not downing anything here. It's the reality that in the traditional paradigm, they've got quotas, just like you've got quotas in your business, and they've got to move on to the next, because there's a tremendous amount of people out there that are sick, and they need to see their doc. Now at Optimum Health, we don't rush you through. We take the time to dig deep and get to the answer. So underlying causes We've got so many external stressors these days. We're dealing with things like hormonal imbalances, our body's inability to actually detoxify. We are faced with millions upon trillions of toxins every single day coming into our bodies through our environment, inflammatory imbalances, structural imbalances, immune imbalances, mitochondrial dysfunction. That's the powerhouse of your cell that actually governs cellular metabolism. Digestive, absorptive, and microbiological imbalances, toxic chemical exposure, toxic emotions, anger, fear, resentment, the list goes on and on. But I'm telling you, these are some of the core underlying causes that are triggering dis-ease that's leading to chronic conditions. And the challenge is, like I said, we're one of the best healthcare systems for acute, but 85% of all medical procedures and surgeries are actually scientifically unproven, according to the British Medical Journal. So we're out there doing treatments, we're managing symptoms, and 85% of what we're doing out there today, because we're looking above the surface, is unproven. We're not getting results, and we must ask why. So again, as we go through this webinar, as you're listening today, I'm going to be shining the light on the whys, and we're going to not just look at your symptoms. We're going to look and we're going to discuss about what's really going on beneath the surface within your body, within your life, what's triggering this imbalance and this dis-ease in your body. So who are we really? Why am I talking to you? Well, I'm one of the team members. The great thing about Optimal Health, we have over 8 offices around the Atlanta metro area. We're an integrative team, and our approach is taking this. What does integrative mean? It means that really we bring the best of traditional conventional medicine and alternative medicine and therapies together so that we can cast a wider net. We can look more extensively and comprehensively at you, not just your symptoms. We want to know who you are. We get to the root of your health care problem. That's our specialty. So now let's talk about thyroid. Again, so all right, we now know traditional medicine, if you've gone into your doc and they're just treating the symptom and they tell you you're fine, but they don't have the ability to look beneath the surface, and you're scratching your head going, why the heck do I feel so crappy? Well, what you need to realize is that your thyroid supports nearly every action in your body. Every cell within your body has a thyroid receptor site. Now here's just some of the key things that your thyroid governs and supports. Everything from bone metabolism. It oversees and regulates your immune system, your brain and nervous system, your gastrointestinal function, your liver and gallbladder, your growth, your sex hormones, your fat burning ability, your insulin and glucose metabolism, healthy cholesterol levels, and proper stomach acid, just to name a few. So as you hopefully beginning to understand, that small gland, a part of your endocrine system that sits right there in the front of your throat, is a powerhouse in ensuring that your body's health functions properly. So, as we just talked about, it governs so much because, again, every cell in your body has this thyroid receptor site. And so when it governs all of this, and if something's not going right, if the necessary hormones aren't attaching to the cell, well, then you're going to start to feel crappy. Not only are you going to feel tired, not only are you going to have a hard time losing weight, but that is, again, when you're going to start having that brain fog. You're going to start having numbness and tingling. You're going to start having GI issues. Your liver is not metabolizing. Your insulin levels are dysregulated. Your blood sugar levels are dysregulated. Cholesterol is going all over the place. You're beginning to have bone mineral deficiency. You are feeling, not only are you feeling bad, but you're aging at an accelerated rate. That's not normal. Now let's look. I want to ask you, you've got a cell phone, I've got a cell phone, right? We all do, because we can't, heaven forbid we leave the house without it, right? What happens if you lose or forget your phone? Slight issue, right? Just a little bit. You feel like you're completely out of sorts. Well, I want to ask you, would you still be using today the same cell phone that you used even 5 years ago, maybe 10 years ago? You wouldn't even think of it, right? I mean, 10 years ago, we certainly didn't have our iPhones and our smartphones and everything at the touch of a finger. It was, call the number and we could text, which was pretty awesome back then. But now we're in a whole different stratosphere with what is accessible to us just at our fingertips, right? Well, You and I both know science and technology is so rapid, and there are new discoveries every single day. Traditional medicine is functioning. We are 20 years behind the research in most protocols and most standards of care. But with thyroid, they're doing the exact same thyroid treatment that they've been doing for 50 years. For 50 years. Now listen, there's so much, and I'm going to share so much with you as we go through this presentation tonight, so much more that's happening with the thyroid that we know about yet. The treatment is the treatment is the treatment. You get Synthroid. You might get Armor. You might get Cytomel. You're going to get a thyroid medication. Most standard is going to be the Synthroid or the levothyroxine. And again, it's a T4 hormone replacement. I'm going to shine some light on this in just a moment, why this is doing you such a disservice. If you are on a thyroid med right now and you're feeling like crap, there's a reason. So hang with me and let me shine some light. Let me take a moment and give you just a very, very short, basic scientific overview of what's happening with your thyroid. Because we all think about thyroid as just kind of the site of where the action's happening. That's where the problem is. Treat the gland. But there are multiple steps along the process where things can go haywire. Yet, the standard of care from the traditional approach is simply dealing with a level of TSH and T4. Let me explain. So first, as you know, your thyroid sits in the front of your neck. Now, before the thyroid can do anything, there's a series of signals that must be sent. Hormones, just so you know, are messengers. That's all they are. Regardless of what type of hormone it is, they're simply messengers carrying very, very important information so that the job can continue to get done from one department to the next, to the next, to the next. It's no different than what happens with you at work, with email chains. It's the same type of flow of information. So in order for the job to get done, everybody needs to deliver their information in a timely fashion, right? I mean, I'm sure you can appreciate this. If you're at your job and somebody doesn't get you a very crucial piece of information when you need it, the whole project can fall apart, right? Same thing in your body. So it begins in the brain, in your hypothalamus. That's where the signaling begins, where there is a hormone called TRH. It's your thyrotropin releasing hormone, which this is the first messenger that's going to go down, and it's going to talk to your pituitary gland to say, hey, we need thyroid hormone. So it's going to go down the pituitary and it's going to tell it to release TSH, thyroid stimulating hormone. The thyroid stimulating hormone then comes into the actual thyroid gland and says, hey gang, we need to make some energy happen here. So what it does, it actually creates two types of thyroid hormone, T4 and T3. Now, let's go to the next slide so you can see this. So T4 and T3, what does that really mean? The best way to understand this is T4 is what makes up the majority of what the thyroid is making, and it's about 93%. T3 is it has a shorter shelf life, but it is your right now energy. I don't know if you remember, stay with me for a minute. I'm going to go back for just a second. See this right here? This is where your T3 is what actually binds to the cell. And like I said, every cell in your body has a thyroid receptor. So it's T3 that is the one that's actually binding to that cell. That's what's doing the work right now for your thyroid. So T4, the best way to think about T4 is, I make the analogy, it's a sports analogy. That's the guys that are sitting on the bench. That is what's waiting, okay? It's got to be converted to become usable. So it's your bench, and they're sitting there going, hey, coach, send me in. Whenever you need me, send me in. Now, there's a few places that the conversion of this hormone occurs, but the main place that thyroid hormone is converted from T4 to T3 is in your liver. As you can see right here, 60% of this conversion happens. Now, the way to think about it is T4 simply means that there's 4 iodine molecules. And when they go through the liver, when this conversion process occurs, one comes off. It's like they just took off their warm-ups, right? And now they're in game gear and they're going out on the court. So the warm-ups come off and now you're down to 3 iodine molecules, and that's what attaches to the cell. Now this conversion, about 20% can happen out in the peripheral tissues. There's 20% that's in an inactive form, okay? And then about another 20% actually converts in the gut. So we've got several different sites of where this is happening, but again, about the 60%, the main portion of it happens in the liver. Let me tell you for a minute why this is such a problem. Well, you know what? Hold on to that thought. I'm going to show you why it's a problem. So that's how it happens. Let's go back one more time. Okay, so thyroid. We're treating, in traditional medicine, we're treating for T4, but T4 is not what does the job. T3 is what does the job, okay? Your thyroid produces it. It's got to convert through the liver or through the gut, and then it goes out, and now it can attach to the cells. But again, we're asking the question, if I'm taking my medication and it's T4, that should mean, my doc's telling me my labs are okay, that should mean that it's converting okay, right? Are they checking T3? Please, that's a question to consider right there. Most doctors are not. Okay, but they're assuming that it converts. But you're saying, I still feel so crappy. And remember, it's T3 that attaches to the cell. So if there's no T3, or if there's not enough T3 able to attach, we've got problems. Because, why? Your thyroid governs so many responses in the body. So, but you've been told, hey, your labs are normal and you're not feeling good. And there's a couple of reasons. So one of the big things is that we're not taking a comprehensive enough look. We're not looking at all the players in the game, and we're also looking at inaccurate lab values. So when you go into your doc, they're looking at lab ranges where bell curves are used. When you get your blood work, that is a bell curve range. Functional lab values are more sensitive to reveal real problems. And what does that really mean? If you're thinking about a bell curve, functional medicine likes to look right here in the sweet spot. That's what I call it, kind of that center portion of that curve where it's a tighter field. And we don't just do this for thyroid, we do this across every lab value. But right now we're talking TSH. So first and foremost, one of the places that we go wrong is that traditional medicine, and they've actually adjusted these numbers a little bit, excuse me, this should be 0.45 and it goes to 4.5. So they have begun to tighten it a little bit, but not a lot. So they come in, they test your TSH, and if you fall anywhere between here and here, they say, oh, you're fine. Now, again, some docs are looking a little bit more closely at this, and if you're around here, they will say, oh, you've got some mild thyroid issues, let's go ahead and put you on some medication. So they kind of say, hey, you know what, there could be something going on here, let's put you on some meds, come back in 6 months, let's see how you're feeling. So they're looking strictly at TSH. But remember, TSH is simply a messenger. Now, you could have a lot of TSH. It could be down here on this side, and that's when they tell you you are hypothyroid, because the idea is the pituitary has said, we need a lot of energy, something's not getting through, so they put out more TSH, kind of like they're yelling at the thyroid. Dudes, get your job done, make more of this stuff, make more T4, make more T3, let's get on it. So TSH is like the taskmaster, okay? And if we've got a really low amount, that means we're hyper. So we've got so much that the brain is trying to say, slow down, thyroid, slow down, don't make as much, T4 and T3. So that's really what TSH is doing. It's regulating, it's saying either make more or less because the body is interpreting based on what's able to attach at the cellular level. Either they've got enough energy, too much energy, or not enough energy. But the only thing your MD is doing typically is looking at this level. They may look at T4, but they're not going any deeper. So the problem becomes, if we're only looking at TSH and T4, we are completely missing the boat, because we're wondering, are you primary hypothyroidism? Now, if you're primary hypothyroidism, you are the person that will respond to the 50-year-old treatment model of you get T4 and it works, okay? So if you're on medication and it's worked and you feel great and it's worked for a long time, you are a very small percentage of thyroid diagnoses. Now, you could be secondary to hypopituitary. Remember, I said there's multiple places where the communication can break down. We're not checking pituitary function in traditional medicine. You could have thyroid under or over conversion. Now, remember, I said that I showed you that slide where the hormones are converting from T4 to T3 in primarily the liver and the gastrointestinal system. So you could be making too much or you could be making not enough. Now you could have your thyroglobulin, you could have your thyroid hormone elevation from increased estrogens. If you're taking birth control, this can also create a thyroid problem. But are they looking at birth control? Are they looking at hormone levels and sex hormone levels? Not typically. Do you have thyroid resistance? Do you have high levels of systemic inflammation? Do you have an autoimmune issue? There are multiple places. I'm going to continue to show you this so it'll make sense as to why and where we need to look, why we need to do more comprehensive testing to get to the root cause to understand what type of thyroid problem do you have specifically. Now, you may be asking, okay, if it could be all these other things, why are my doctors not running these tests? Because they're doing the same protocol. It doesn't matter to them what type of problem you have. They're going to give you thyroid hormone, and they're going to give it to you. They're going to up your dose as many times as they have to, because eventually they know if they keep you on it, your thyroid is going to burn out. It's going to stop working. You're just going to stay on the medication anyway. So the option is either burn it out with radiation if you've got cancer, or if you've got nodules, or if you're having even some autoimmune activity, they're going to want to do radiation on it, or they're going to go ahead and just put you on medications in either such a high amount that it burns out on its own naturally, and then you just stay on the medication because they just think, oh, there we go, it's done. And even if you've had your thyroid removed and you're on medication, I know you can say yes to this, you're still feeling like crap because the thyroid gland itself wasn't the problem. But in medicine, they don't have time to look at this other stuff, and even if they found something else, they don't have a treatment for it. The only treatment they have is giving you Synthroid or levothyroxine. Now, we're facing an issue where about 80% of all women are diagnosed with a thyroid condition. But among those, many are being misdiagnosed because 90% of our thyroid symptoms are due to autoimmune disorders. We now are in such a toxic environment, from the foods we're eating, the air we're breathing, the water we're drinking, the chemicals we're bringing in from our makeups and our body lotions and our hair products and our clothing and our fabrics. It's insidious. It's everywhere, okay? From the plastics that it's leaching, these chemicals that we're putting in our microwaves and eating our food out of, it's everywhere. And I'm not trying to freak you out, and I'm not trying to make you feel hopeless. I'm wanting to educate you so that you can become empowered to know, what am I doing, what am I not doing? What can I begin to shift? Even one little difference will begin to make a difference in your health, okay? But listen, autoimmune is body attacking self. Body attacking self. And when we have an autoimmune issue, this is why you're feeling so bad. Because again, 90% of all women with thyroid issues are being misdiagnosed. It is a small percentage that actually respond to T4 medication alone. If you're on medication and it's not working, there's more going on, okay? And if you keep going in, you're not on medication yet, but your thyroid levels keep showing fine, but you really think you've got a thyroid problem because you've got all the classic signs and symptoms, they probably have not tested you to see if you are Graves' or Hashimoto's. Because when we have an autoimmune, now, or you could have another autoimmune condition happening in your body, when we are in an autoimmune state that is creating a constant inflammatory attack, body attacking self. Other things I'm going to show you in a minute cause inflammatory responses, but here's the thing that you need to know about inflammation in your body. Inflammation is a natural response. It's really a good response. It's your body saying, hey, there's a problem here, let's attack it, let's get rid of it so we can be okay. So we want inflammation when it's appropriate. You sprain your ankle, you want to have it swell up for 72 hours. You want the immune system to come in and clean up the damage and stabilize it so you're well. But in autoimmune conditions, it's a negative feedback loop. We're always being triggered, and it's kind of this never-ending cycle. So our bodies are in a constant state of attack. We're in a constant state of inflammation. And there's two sides to your immune system, okay? And the way that the sides of the immune system talk is through this very important protein called a cytokine. And the cytokine, in order to tell which side of the immune system to do which part of the attack and what to do and what's going on, the way it hitches a ride to get there and pass the message is it sits right here. Check this out. This is what's so key, friends. I know this is science and you're probably like, oh my gosh, but this is important. This is important. I'm helping you understand your body. This is why you feel like crap, even if you're on medication or even if your lab values are normal, right here. The cytokine, if you're in an inflamed condition, sits where T3 is supposed to sit. Then guess what? T3 can't hitch its ride. So that message cannot get delivered. It cannot attach, can't get to where it's going, and all of this starts to happen. Fatigue, increased weight gain, even with low-calorie diet, morning headaches, depression, constipation, cold, hot sensitivities, poor circulation, muscle cramping. You're catching cold. Your immune system is constantly depressed. You're having so many ongoing problems with coughs and colds and viruses. Your wounds are healing slowly. It's another sign that your immune system is impaired. You are requiring a ton of sleep and you're still not feeling rested. You're having chronic digestive problems, itchy, dry skin, dry, brittle hair. Your hair's falling out. You're having edema. You're losing parts of your eyebrows. You are just not feeling like you. Okay? Here's some triggers. Now, as we go through this, this is where I want you to tune in and I want you to take note how much of this could be at play in your body. Okay? Just from your lifestyle and the things that are going on, what could be happening? Begin to think about this, because these are the places that you can begin to immediately make changes on your own. Is it worth digging deeper and really knowing what's at root cause? Yes, absolutely, no doubt about it. But health, healing is not just about finding out what is going on, but then it's about helping yourself to reverse what got you there. Okay? Definition of insanity: doing the same thing over and over but expecting a different result, right? So if you think you're going to just keep on doing what you're doing and you're all of a sudden going to miraculously feel different just by taking a pill, that's not enough of a change. You've got to realize there's more at play. So please take some notes on this so you can start to think about it. Now, first and foremost, stress sets this whole thing into motion. Stress. There's physical, mental, emotional, chemical, environmental. Stress is the fight or flight response. Again, it's a very important life-saving response. And it was really good back in the days of, when we were going out as hunters and gatherers, and we'd go out and we'd be hunting our food and exploring new terrain and not knowing what was going on. And we had to be on alert if all of a sudden a bear jumped out, right? We're trying to hunt and the buffalo comes out. And is it going to charge us? We've got to be ready to take action. So fight or flight literally is that. Your body, it readies you through a chemical hormonal cascade to say you're either able to fight or you've got the energy to flight and run and save yourself to get out of there. It is a primal life-saving response. Now, back when we were settling, the United States, when we were discovering new terrain, when we were the hunters and gatherers before we were an industrialized nation, this would happen, but it didn't happen 24/7. Today, our stress response is being fired off 24/7. From the news you're watching, from the articles you're reading, to the emails that are coming through, to the tweets that are coming across, to traffic that you're sitting in, to not enough sleep, to too much caffeine, to anger, to frustration, to lack, to limitation, to financial stress and strain. We are being triggered all of the time. And this is detrimental. This can be very detrimental to your overall health and well-being. And so let me just tell you really quickly, the moment that you start with stress, there is the chemical release. First, the brain signals to the adrenals. Your adrenal glands are part of your endocrine system. They work in symphony with your thyroid. And so the adrenals govern the stress response, the fight or flight. As soon as they're signaled that there's a threat, even if it's imagined, this could just be thoughts going through your head. You're remembering, crap, I forgot to get that done. Oh my gosh. And you're thinking about it all night and you're not sleeping. Okay, that's real or perceived. Your stress is stress is stress. It's still going to trigger the brain. Okay, so regardless of what type it is, now the brain is talking and it's saying, hey, problem, release what we need so we can fight or flight. It's releasing the powerful hormone cortisol. Cortisol, my friend, is highly inflammatory. It's highly catabolic, and it also is going over and it's talking to your liver to say, look, because liver is where glucose is stored. Hey, look, I need some energy right now. Glucose is our right now energy to the body. That's what fuels the muscles. That's what gives them the energy to fight or flight. So it's saying, give me this. Well, this whole thing, and I'm going to go through it, creates this immune cascade, this inflammatory response. Now remember, we're trying to think, what could be keeping me feeling so crappy? And if inflammatory responses produce this protein called a cytokine that blocks my thyroid hormone from being able to hook onto the cell, then these are not good things for me. So how stressed are you? On a scale of 1 to 10, 10 being the highest, what's your stress level? If it's an 8, 9, or 10, you need to begin right here. Begin to take an assessment. Begin to think about what are ways I can better manage my stress. That's key, because if you can't get this under control, this trumps everything else. It really does. So begin to think about that. It's going to create this inflammatory response, which can mimic, and it can also create a long-term or mimic a autoimmune response, but it's going to block thyroid function. Next, food sensitivities create inflammatory responses. Food sensitivities can also become autoimmune issues within the body. Food sensitivities, things like, you've probably heard it, gluten, dairy, soy, corn. These are some of the most highly inflammatory foods to our body. Why? Because we eat them so much. High fructose corn syrup, they're in just about everything that comes in a box or a bag that's quick and convenient. And so what these foods do, we're getting them over and over again to our body. The easiest way I can explain this to you. Right now, I want you to take your finger and I want you to put it on your hand. And I want you just to start to lightly just scratch, just so light. I mean, it should actually feel nice at first, so you're just lightly scratching. But if you were to keep doing this for a minute, for 5 minutes, for 10 minutes, it would begin to irritate that skin. Soon, you can stop now, soon you would actually see a red mark on your hand. Okay, these foods that we're eating, they're genetically modified, meaning they're not in the original way that they were grown and intended to be used by our body. So our body gets them in and goes, what the heck is this? What do I do with this? How do I utilize this? And it takes longer for it to break down. And we're getting them constantly in the system. So it's like a constant attack of this, which wears down the lining of the gastrointestinal system. It's always creating an inflammatory response. And the more inflammation we have, the more it breaks things down, which can then lead to some more problems, which I'll talk about in a minute, called leaky gut, which is happening down here, even with GI infections. Now, I told you about insulin surges. Insulin surges are coming with the foods that we're eating because we're eating a tremendous amount of high fructose corn syrup. We're eating way too many simple carbohydrates. Yes, carbohydrates are good for you, certain types of them, but if you're not eating them with a protein and with a healthy fat, what they're doing is literally making your blood sugar spike up high, and then it's dangerous for your blood sugar to be high, so the brain says, whoa, we need to clean this up. So it's going to release insulin to help. Insulin cleans up all that extra glucose. It helps to bring it in and it tries to store it back in the cell. Okay, the more that those cells are full, the more that the liver is full, that's when we start to have a fatty liver. That's when our liver can't convert. It can't convert our thyroid hormone. It can't detoxify our body. So then things start backing up into and creating fat. And then all these toxins begin to store in the fat. These toxins are estrogen dominant. And so now we're having all those things. If we go back a few slides, come back with me. Estrogen dominance can be a problem, over conversion. This happens in the liver, this happens in the fat tissues of the body, okay? The autoimmune, the high levels of inflammation, this is everything that we're looking at right now, my friend, as we're going around this wheel. I know it's nice to have all sorts of different slides triggering, but again, this is what's happening in your life. Now let's talk GI infection. This can also create inflammation. This is if you're taking a lot of antibiotics, if you're on a lot of medications. Again, if you're eating a diet that's high in gluten, you may be saying, what the heck is gluten? It's anything that contains wheat, oat, rye, barley, spelt. And that doesn't just mean whole wheat. Anything that's made with flour, unbleached, bleached, whole wheat, okay? Anything that's made with flour is made from wheat, and it's a gluten product. So white bread, brown bread, honey bread, all of it doesn't matter. Sourdough, unless it says gluten-free, it's got gluten in it, okay? I'm sorry to tell you. And if you're eating a lot of it, again, that's another thing that's going to break this down. GI infections are also parasites, candida, fungus, okay? Bacteria. Because of the food, because of all the sugars we're eating, because we're eating things that are hard for the body to break down, they sit and they sit. And all of a sudden, your GI system becomes like a garbage can. I know it's not pretty, but literally that's what happens because it's taking longer than it should for food to digest. And when it sits, it begins to rot. When things rot, it's a perfect breeding ground for bugs. And all of this creates inflammation, which not only is it going to make you bloat, is it going to make you lethargic. 80% of your immune system lives in your gastrointestinal tract. Your neurotransmitters, the chemicals, the feel-good chemicals in your brain, are also made in your GI tract. In fact, your GI is called your second brain. So when you're having that fuzzy brain, when you're having all those GI issues, when you're constipated, and when you bloat with everything you eat, even if you're drinking water, you have got serious GI imbalances that are causing a ton of inflammation in your body, which, when we talk about thyroid, is keeping your thyroid from working properly because T3 can't bind, can't do its job. Now, because of all of the Splenda and aspartame, those things break down to formaldehyde. That's fun. And they begin to clog up and break down your liver. High fructose corn syrup converts to alcohol. And so that's got to be processed by the liver and it's creating fatty liver. And we're seeing fatty livers even in our kids now. It's highly disturbing because of all this high fructose corn syrup. And if that liver's not working from medication or from foods that we're eating, remember, 60% of thyroid conversion happens in the liver. It's not converting. So you could be taking Synthroid all day, but if that T4 doesn't convert to T3, then it can't bind and attach to the cell and do the job. Again, hormonal imbalances, we've got a huge estrogen dominance. Soy is a plant-based estrogen. It's just in about every food we're eating. Heavy metal toxicity, there's so much of it. Lead, mercury, copper. We've got tons of it in our water supplies. We've got tons of it in our medications, in our vaccinations. We are getting this stuff and we're just getting too toxic. And guess what? If our liver isn't working, we have no fighting chance of getting this stuff out of our body. And then iodine exposure. If you are Hashimoto's, if you are primary hypothyroidism, iodine is actually very important, okay, because your thyroid hormone is iodine. But if you are autoimmune, iodine will actually trigger a more aggressive response and create a much more severe problem. So if you're taking iodine and you're feeling like crap because you read on a blog somewhere that iodine is a good natural supplement, please make sure you're getting the proper testing because if you are autoimmune, you're doing more harm than good for yourself. Okay? So here's the thing is that Hashimoto's also looks like, autoimmunes all have a very, very similar situation going on. And 50 to 60% of Hashimoto patients, that's the autoimmune version where the body is attacking the thyroid gland, have other organs being attacked. The pancreas, which is what causes type 1 diabetes, the myelin sheath, which causes MS, multiple sclerosis. In the brain, is what's contributing to Parkinson's, Alzheimer's, dementia. Your intestines, which is where Crohn's and IBS is coming from. Your joints, which is rheumatoid arthritis. Your uterus, which is endometriosis. Your stomach, which is where pernicious anemia can be going on, and your spine with osteoporosis. Gang, this is serious stuff, okay? It's serious stuff. And if your body's talking to you, please honor it and do yourself the favor. Don't guess with your health. This stuff only gets worse. It doesn't go away just by taking a pill. And if you've been taking it and feeling like crap, you're beginning to understand the truth of that statement. Can you get help? Yes, yes, yes. Now listen, what you need to do is, if you're suffering, you've got to realize there's more going on, and it's not that your docs don't care about you. They do. Medicine isn't bad. Look, I work with medical doctors. I'm on their team. They're on my team. That's what makes us an integrative practice. But we look more extensively. We look and say, wait, is it just a primary hypothyroid issue, or is there more going on? So you really want to order the correct test so that you and your team, your practitioners can determine the true underlying causes, so that then you can focus on the cause, not just treating the symptoms, because clearly symptom management is not getting the job done, okay? It's not getting the job done. It's going to help you by getting the right test, by letting us know what's really going on. We can correct the dysfunction and not just alter your labs with drugs. Drugs are last choice for us, okay? Medication is last choice. If you're on medication right now, we will not take you off of that, okay? We will work with your doctors. We will help you to naturally work and understand what's the imbalance, so that when and as the labs show that it's safe and appropriate to lower the dosages and or come off of those medications, we will be working with your doctor, sharing that information to help you get to that point. Is it possible? Yes. I will tell you, I have seen hundreds of patients over my years in practice be able to reduce their dosages, and about 25 to 30% have been able to completely come off their medications for a lifetime, completely healthy and whole. So we're going to address your body as a whole. We're going to take a systematic approach, but we're not just going to tell you what's wrong. We are going to give you a step-by-step system and path, complete with education, with inspiration, with support, and with the proper nutraceuticals if you need them, if the proper medication if you need it, to truly correct the dysfunction. We're going to mentor you the entire way, okay? So listen, I want you to really think about this, and I want you to consider what it would be worth. Because for some reason, something brought you to this webinar today. You're listening to my voice because you've had a problem, or someone that you love and that you know has been struggling. And you've just had a feeling deep inside of you that there's more going on. You know your body. And you know that even though you like your doctor, and he or she has been there for you and done a good job, you feel like they're just not hearing you. They're not getting you, because you know your body. I know you do. And you know that something's not quite right. So I want you to consider, what would it be worth to have a team of integrative healthcare professionals support you and get to the root cause of your health problems? What would it be worth to have a team that looks beyond just your symptoms and treats you, the person, the human being, not just lab values, but you, talks to you, listens to you, understands you, helps you? What would it be worth to get the answers and have a plan? Now, this is the key part. Not just, well, yeah, here it is. Go take your medication. Come back in 6 months. A plan that engages you, that gives you step-by-step direction to correct your health challenges. The bigger question is, what is it costing you to do nothing? What is it costing you in your relationships, in your energy, in your career, in your sense of self? What's it costing you to just treat your symptoms? I want you to know that right now you're at a crossroads. And I am so glad that you are here, that you've stayed on this webinar to this point and you've been listening, because you do have a choice. You absolutely do. You can either, keep doing what you've been doing, and there's nothing wrong with that. Please know I'm not judging you or your doctors. I'm here just to educate you today. That's all it is. I want to inform you. I want you to know more about your body, and I want you to know that if you are feeling crappy, then there's just more going on beneath the surface that hasn't yet been looked at, understood, and addressed. Because when we get a more comprehensive look, when we understand more of the pieces to the puzzle, well, then we can get off that old merry-go-round. Then we really can have new information that can fully give us the clearer picture of taking a new approach, okay, with a complete path and system. So keep doing what you've been doing. And if that's working, okay, great. But if it's not, then why do you want to keep driving yourself insane? There are more options. There's more out there. You are worth knowing what's happening within your body. So will you do it? Will you do it for you? Because if not for you, and I'll tell you, I get this. As women, we are at fault of being the superwoman, right? And taking care of everything and everyone else, right down to the neighbor's dog, before we would take care of ourselves. But if you can't do it for yourself, if you feel like it's being guilty, it's being selfish, if you take time, because look, I get it. It takes time to fit it in the schedule and go to a doctor's appointment and get some testing done and get some answers. And then what if they find something? What does that mean? Could you have to change things? And you have been just getting by right now in a way with your daily behaviors and patterns that work. Maybe they're not giving you the best result, but they're functional. And what if you have to change some of those things? Okay, yeah, what if? Because I'm going to tell you, if what you're doing right now isn't working, it's only going to get worse. Sure, you can buy yourself some time. You don't have to make the time right now. I'm not telling you that you have to. But when will you matter enough? And who counts on you? Because if you're not thinking about the other people in your life, and I'm just going to be honest with you, then you're being selfish. You're being selfish because they need you, and you can't be anything. You can't be your best to your job, to your family, to your friends, to your community, to the things that matter to you if you're not taking care of your health and of yourself. So who counts on you? Who needs you? You need to dig deep and you need to discover your why. Why? Why does your health matter? Why does your energy count? Why is it necessary for your brain to be clear? Why is it important to feel strong and energized in your body? Why is it important to have your stomach feel good, for the weight to come off, for your body to be able to digest, for the bloating to be gone, for you to be able to get a full night's sleep? Why does all that matter? Because it does. You know it does. So if not for you, then who? Now listen, if you're sick and tired of surviving, if you want to thrive, if you want to gain the help and the support, then Optimum Health can help you. We can, in any of our 8 locations, because we specialize in integrative natural health care that treats more than just the symptoms. We treat you, the person. We listen, we take time, we don't rush you through, we understand. We have a team of experts that will help you to get the answers. And really importantly, please, this is a huge differentiating factor for us. We create a plan that's going to help to get you well. You don't have to suffer any longer. You don't. Okay? So I want you to be able to get the help that you deserve. And so you've just invested time, which I want to congratulate you on. This is so important that you've said yes to you just by sitting here and listening to this. So to come in, you're going to begin with a complete consultation and wellness evaluation with our nurse practitioner. So one of our leading nurse practitioners are going to sit down with you and they're going to go over from head to toe what's happening and so that we can really get to that root cause. Now then they're going to give you a plan of action. And what that means is they're going to make based on what they've discovered during that wellness evaluation, they're going to give you their best plan of what we need to continue to look at. And then as we get your test results back, we will prescribe your lifestyle classes, we'll prescribe your time with your coaches, we will prescribe your treatment plan, exactly what you need so that there's no stone left unturned. We don't expect you to figure this out by yourself. We are your team. Now your initial investment is just $150. And yes, this is normally over $287, but you've already invested some time. And the great thing is, yes, we do take insurance. If that's what you're wondering, yes, we do. And most insurances cover a good portion of what we are offering in our programs. That's why we're an integrative practice. We bring medical, we bring alternative together to really help you get the best of both systems so that you can get the answers and the support you need. Now listen, if you want to go ahead and take advantage of this right now, do not wait, because I can't tell you how long we're going to be able to offer the $150 sign-up fee for you. So again, it's normally $287, but you've been listening to this webinar, so today, for being on this, you're going to get the $150 sign-up complete evaluation with the nurse practitioner. Go to www.optimumhealthrehab.com. Again, www.optimumhealthrehab.com. Sign up now. We have 8 locations. When you go to our website, you're going to be able to choose a location that's closest to you. You can always make mention that you were on this webinar, okay? And they're going to go ahead. Within 24 hours, my team is going to call you, and we're going to get you on to the closest location to you at the first available appointment that we've got. So listen, we're here to help you. You do not have to struggle. You don't have to wait. You matter. And I want to help you. I want to see you thrive because you deserve it. So listen, call or go online now to request your compliment. Now this does say your complimentary consultation, because here's what I want you to know. This is 2 things you get. If you're not sure, if you're listening to this tonight and going, okay, Dr. Melissa, this makes sense, but do I want to come in for the $150 wellness eval? I'm going to tell you, if this webinar has resonated with you, then yes, you need to. But if you're not sure, we offer you a 15-minute complimentary consult. Okay, so you get to talk with our clinic director. He or she will make sure that you're in the right place. So there's no obligation. You do not have to move forward. But when you get there and you decide, yes, 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 I'm in the right place, they get me, and I want this help, that's when we're going to charge you only $150 versus the $287. Okay, so go online or call us 1-877-704-1761, or go to www.optimumhealthrehab.com. Sign up now, make that request. My team will contact you within 24 hours. It has been such a pleasure, such an honor. You don't have to be sick any longer. If you're struggling, there's more going on. Listen to your body. Take action. Tonight, make sure you're beginning to assess what's your stress like. What types of foods are you eating? Are you moving your body? Are you getting good hydration? Are you getting good sleep? Those are lifestyle things. Are you on a ton of medications? Have you been on a lot of round of antibiotics? Is your immune system weak? Are you suffering from GI issues? Do you think you might have an inflammatory problem or food sensitivities going on that could be part of the underlying issue? Get the answers. Don't wait. Don't be in the dark. It's been an honor. It's been a pleasure. From my heart to yours, I'm Dr. Melissa, one of the team of specialists at Optimum Health. We're here for you. Call today, 877-704-1761, or visit us online to request your complimentary consult or your full evaluation for only $150 right now. Don't wait, don't wait, don't wait. Do it. We want to help you, and we can. Thanks. I look forward to seeing you in my office soon.